Welcome, my name is Ryan Belkoff. Today we are going to continue with OCRA. So if this is the second of three, if you're um, out of place, just go back to the first. So we'll continue on. So again, same objective, so learning when to use OCRA, how we use this tool, and what recommendations come from it. So number two, we continued off from the first lecture. So this is work duration. As you can see, as Americans, we work pretty hard. So we're ranked seventh in the world. That has, gone up and down based on regulations. Early 1900s, they added that 40-hour work week. Before that, we were working triple that, which is kind of crazy to think about factory workers working 100 hours a week. So, but now, current day, we still work pretty hard. Seventh in the world. Mexico's number one. I'm actually not too surprised with this. So, OCRA is looking at this work duration. And so, obviously, if we work less than 8 hours a day, we're having less exposure. So if we work more than 8 hours a day on this OCRA score, it increases that multiplier and decreases how much we should be doing, which makes sense. So the reduced score really comes at 7.5, less than 7.5 hours. In between, there is no effect. And so many nurses, firefighters, a lot of big factories, so many workers working 12 hours a day. So lack of frequency and that work duration. So looking at here, how many hours the working duration. So counting how many per that work week. So certain days you might not be working as much. Certain days, certain parts of the shift, you might be doing more frequency. So people do all kinds of things to reduce their frequency. Anytime I see concrete work, the little bit I've done, it gives me shivers because it's a lot of hard work. So these guys, trying to smooth out that concrete with some creative ways. But with OCRA, really we're looking at a frequency of between 0 and 70 actions per minute. Remember, they're categorizing those actions based on certain movements. So part of that frequency, they divided it up into two categories. Remember, static, you're more compromised because you're not getting that blood flow, as well as the waste products are not leaving. So of the two, usually static is more injury prone. But it divides up lots of different ways to look at static. So when we look at the length of so looking at how long they're holding it for static, and we'll go through that. Dynamic are counted, so the number of observes in a single cycle. And for this, so the Excel does a net cycle length. So looking at static, number of ways we don't really think about static that it could be. We would think is dynamic, but holding an object while polishing it with the other hand. So one hand is holding it at least 5 seconds here of the 2/3 of the cycle time. So that would be an example of the static. This OCRA checklist look at that frequency of the action between dynamic and static. It scores whichever one is higher is the one that you want to use. So we are on our way. We've done 3 of them with lack of recovery. Remember that 20% or 5 to 1. The duration, if it's 8 hours or more for decrease, and then the frequency if it's dynamic or static. So looking at awkward postures is one of the OCRA scores. So it's going to look at the most hazardous score. So below is example, guy overhead holding it while pulling. So, this is definitely a hazardous posture. Then the OCRA does it by each regions. So there's 4 of them. And so I'll look at between the fingers, shoulder, wrist, and elbow. We'll go through those ranges of motion. So fingers, the hands have wonderful dexterity, doing all kinds of movements. Being a healthcare provider, I've seen a lot of patients with hand injuries with like musicians, for example. My stepson was in the orchestra, and even though he was young, so he didn't have any problems. In practice, I did see older folks having problems with their hands, especially, but a lot of people work with their hands, whether it's construction, manufacturing. So we're looking at this pinch grip in particular. When we pinch, it causes more increase to that medium nerve. So a lot of times we think about carpal tunnel with typing, but there's other things that are definitely, and pinch can be one of those that compromises. And then other ones, we have hooking grips, palmar grips, all kinds of the grips that the hand can perform. And then with the shoulder, we're talking mostly the end ranges. So AB, abduction is away from the body, going straight out, making a sunrise type of thing, whereas ADD is towards the body. Extension, going straight back, and flexion going straight forward here for flexion. And with shoulder, even though it has incredible range of motion, usually we're looking at the end ranges of motion for the awkward postures. Wrist, again, flexion going towards, extension, ulnar deviation, palmar deviation, or radial deviation. And so when we're looking at this, usually when our wrist is flexed, in particular with a lot of force, we're compromising that medium nerve, increasing chances of injuries. Elbow. Elbow is not as much about the motion as the action that is going to take. So but the actions of pronation and supination. So I think of supination, the easy way to think of this is holding a cup of soup, whereas pronation is going down. So that turning usually influences the radial nerve. And so we got tennis elbow on the outside, whereas golfer's elbow is more on the inside based on those movements. So, there's sports which we do for fun. Work is usually we get paid for it, but remember, work in our ergonomic terms is anything we do with the body for movement, and with the elbow in particular, but it can also be the shoulder, any jerking, striking movements. So these are easy ones with pitching and those type of actions. But if you're swinging things like, a firefighter swinging an axe, for example, that would be a striking movement and jerking, right? So one of the terms that OCRA uses is as stereotypical actions, and all they mean is sustain posture of more than 50% of the task. So you'll check that box for a stereotypical action with an increase in awkward posture after sustaining that. Okay, so that completes our second of 3 on OCRA. So we've gone over the lack of recovery, looking at that 6 to 1 or 5 to 1. The duration, looking at 8 hours or more for a decrease in modifiers. The frequency of the action, so we got a sustained static postures versus dynamic postures, awkward postures. We're looking at those 4 limbs. So we'll continue on. So from this, overall, we want to know when we're using OCRA, how we're using it, and what are the recommendations.